is approximately 1:40 p.m. Apologies for my tardiness, but we're going to get right into it. Why don't we establish a quorum? Madam Secretary, please call the roll.
Senators Cannella?
Here.
Cannella here. Leyva? Here. Leyva here. Mitchell? Here. Mitchell here. Runner? DeLeon?
Here.
DeLeon here.
Okay, we've established a quorum, colleagues. We're going to go to file item number 1, that is bill referrals. I believe that you already have reviewed the measures. Can I get a motion, please? We have a motion made by Mr. Cannella. Madam Secretary, please call the roll.
Senators Cannella?
Aye.
Cannella aye. Leyva? Aye. Leyva aye. Mitchell? Aye. Mitchell aye. Runner? DeLeon?
Aye.
DeLeon aye.
Thank you very much. Motion passes. We're going to go to file item number 2. We have, I want to make sure I get this correct, Claudia Christ, Claudia Christ, as well as Mr. Brandon Nunez, Portuguese?
Yes.
Okay, why don't you both come up? Okay. Both are chief deputy directors, both for the State Department of Public Health, with different portfolios under your jurisdiction. Why don't you introduce yourselves? Any loved ones, family members you'd like to introduce, please do so. You can speak about your person for a few moments in your introduction. Then we'll go to questions and answers from the committee members. How's that sound?
Sounds perfect.
Okay, all right. Who would like to start?
Thank you, Mr. Chair. There are a few members I'd like to.
Fantastic chivalry there, Mr. Nunez.
I made the attempt.
I throw it up to see what happens, and go ahead. Just
Well, I got that from my parents. So my parents, Al and Kate.
Equal partners here, equal.
And my wife, Jennifer.
Your mother and father, right?
My mother and father, Al and Kate Nunes.
Welcome.
And my wife, Jennifer.
Oh, where with Jennifer? Oh, welcome, Jennifer. Fantastic. Okay.
Thank you.
Thank you.
Hello, Claudia Christ, and I have with me here today my sister Katrin Rode and my very good friend and triathlon partner Robert Ojeda.
Robert Ojeda, pleasure. Welcome. Okay,
Thank you.
where would I like to start? Please do so.
Thank you, Mr. Chair and members. I'd like to start off by thanking Governor Brown for this opportunity to serve as Chief Deputy Director for Public Health, or for operations at the Department of Public Health, and I'd like to thank all of you for this opportunity to discuss this nomination today. Prior to coming over to the department, I spent 16 years in state service, mainly in fiscal policy and administration within the Department of Finance. About half that time I spent doing audit work, doing audits of various state entities, reviewing their operations. And then on the other side, I spent 8 years doing budget work at the Department of Finance, administering budgets for departments within the Health and Human Services. And it was during that time that I had an opportunity for a few years to work with the Department of Public Health and to get to know their programs and to be able to know the people. And those are some folks that I'm actually privileged today to be able to consider colleagues. So again, thank you for your consideration today, and I'm happy to take any questions you might have.
Thank you very much, Mr. Nunez. Ms. Christ.
Thank you, Chair DeLeon and members of the committee. I would also like to thank the Governor for the opportunity to serve as Chief Deputy Director for Policy and Programs at the California Department of Public Health. And I would also like to thank you for this hearing and for your consideration. Having spent the last 25 years working in and gaining experience in various areas of the healthcare setting, it is a great honor to have the opportunity to take that experience and transition it to public health. Given the transformation and the dynamic changes that are happening in both fields, public health and healthcare, there isn't a more exciting time for somebody like myself to make that transition and to be part of facilitating the public health, the healthcare community coming together and working with our diverse local communities to enhance the health and well-being of the people of California. Thank you.
Thank you very much. What we'll do right now, Ms. Christ and Mr. Nunez, is we'll open up to questions and answers or commentaries from the members themselves. So we'll start with Ms. Mitchell.
Thank you, sir. Good afternoon again. Appreciate you all being here and having the opportunity to have a conversation about a complex department that has lots of work to do. We had the opportunity to have before us in Senate Rules Dr. Smith, who I was very impressed with. That sounds so, but I was. She was very impressive, but she was. Given her focus on it was clear that she has a fundamental understanding about the role of the department, the challenges before the department, and I appreciated her discussions in a real meaningful, tangible way about culture shift, and she presented herself as a true leader, and I appreciated that in her. You two really get your hands dirty regularly as the chief of programs and operations, and that's clearly where the nuts and bolts are of any state agency. So I just want to ask you several questions today with regard to risk areas, both operationally and from a programmatic perspective. Could hear, your responses with regard to the audits, and I'll talk a little bit about your vacancy rate, regulations, and get a little into one of the long-standing challenges you all have experienced, the department has experienced, not you, the department has experienced with regard to licensing and certification. So if we could start, just from your perspective, you both have been on the ground now for a while, what are the issues in your department that, wake you up 2 or 3 o'clock in the morning? What are the areas of greatest risk? I think both operationally, because running a department that size, there are operational risks, but also because you are the Department of Public Health, what are the programmatic risk areas that give you cause for concern? And what are your strategies to deal with them?
So starting on the operations side, one of the things that I knew coming in to work for the department was obviously that we had a couple of challenging areas to deal with. And one of those issues was our designation, or is our designation as a high-risk audit agency. And I guess this may go towards my background as being an auditor, but one of the things that I see is that while I think that's a challenge for us, and I want to work towards getting us off that list. And just so you know, a little background, that report came out in March of 2015, and one of the things that the report said was that our department was slow to implement recommendations that the auditor had. And so for me, and as you mentioned, you heard from Dr. Smith recently about how one of her challenges that she believed was within our department was to get our administrative house in order related to our operations. So I see those audits as a concern to get us off the list, but also as a benefit because the auditors have come in, they've identified areas of concern, and I think we can take that opportunity to address those recommendations. And one of the things that and to be able to get us off the list and to also be able to improve our administration within our programs. And one of the things that we've done is we've bolstered our internal audits within our department. And what we've done is we've taken a look at what types of audits we've been subject to, what types of recommendations the auditor has come up with, and we've shared those out to the programs as a way of learning and saying, these are the types of things that when the auditors come in that they've been noticing as a challenge for us. And so start to look at those within your own operations to see if you have the same types of issues. And I think that's one way in which we're doing it. We're also doing a much better job of tracking those audits now, and we have a handle around what they are and what we need to address. And we have, again, someone in our audit division who is focused solely on addressing those and working with our program areas to address it. More long-term, though, one of the things that we're looking to do is we're working with the Office of State Audits to take a look at what an Office of Compliance might look like within our department. We are subject, of course, a lot of our funding comes from federal grants, so there are federal requirements there, and of course just the program requirements in general. And so having a more robust Office of Compliance within our department, I think will go a long way for us to be able to be proactive and identify some of those issues before auditors actually come in and address them for us. So that's one of my high priorities. It's a risk area, but I also see it as kind of some low-hanging fruit where we can start off doing some real good.
And I think a productive way to look at an audit, an audit doesn't necessarily have to be a 4-letter word.
Exactly.
It can provide guidance and direction to quality improvement in terms of your product and your program.
It's a roadmap, if you will.
From your perspective, Ms. Christ, in terms of risks you foresee externally and internally in terms of the nature of the department?
Certainly. Well, given the breadth of the 200 or so programs, one of the most daunting things is really thinking about public health and what it encompasses, and that it's really important that we have a very, very close-knit system, a system of prevention. We have good partnerships with our external stakeholders, with our local healthcare districts. and that we make sure that we have consistency within the department in areas that are, in all areas, but really in areas that are most critical. Consistency in processes, making sure we have quality and continuous quality improvement. And there are two areas that's really important. And we hear in the news a lot about outbreaks, either foodborne outbreaks or viruses, and there seems to be something new happening all the time. And so the new normal is really that we have multiple of these happening at the same time. We don't just have kind of one happening and then it goes away and then we don't have anything for a long time. So really ensuring that we have the resources and we're aligning our programs in a way that we can respond quickly, we can shift resources and priorities as necessary in order to keep the public safe. And also when audit reports show things, usually the breakdown reflects a breakdown within programs, and that's one of my areas as well. So it's really important that we work closely on ensuring that as a leadership team, myself included, and the programs are really part of the audits and really help work with the auditors to oftentimes prevent audit findings just by providing the information that they just are asking for throughout the audit. And really then also executing on recommendations and doing the follow-through. So one area being more on the operations side, but very much impacting program, and the other side being really being able to react to outbreaks, and then the other one is to really prevent bad things from happening. And that is where licensing and certification, we do this in multiple areas within the department. And one of the areas that is more often in the news when it doesn't work well because there are loved ones involved of people is within the facilities and hospitals and long-term care facilities. And this is where being very, very diligent about eliminating any unnecessary variation process, responding timely, and being very proactive in our survey work, and being very consistent in how we do the work is very, very important.
One quick follow-up, then we'll go directly into the issue about licensing and certification as well as regulations. 200 programs. Like, really? So are all of them couldn't be created equally as weighted and important. Is it appropriate from your, and I bet some of them are gifts from us to you, because we as legislators, we have great ideas and we want a new program in the Department of Public Health to do this and that. So of the 200, are you able to wrap your arms around them? Are they all currently relevant? What 200 of what?
What an excellent question. I think this is exactly the question that we're asking ourselves right now, is to look at our core public health function, and then also looking to what do we need to look like as a department to be relevant 20 years from now and to be effective 20 years from now, knowing that there's not going to be more money coming into this field most likely. We have to be really looking at what do we need to look like, what does our workforce need to look like, what do our programs need to look like, and what are the opportunities. And that work is happening in the department right now in our work that we call Public Health 2035. And so we're looking at that very, very issue.
And there are some areas where more money should perhaps be coming into your department. It's come to my attention around STD surveillance. There are some counties, Butte County has a 390 some odd % increase in certain STDs. So in terms of public health, there are some areas that probably require some investment. So we should have that ongoing conversation. Going back to the real, I think, elephant in the room, and that's with licensing and certification, and you referenced it. You know that department, that division has received many critical reviews regarding investigation deficiencies, backlogs, and an inability to handle consumer complaints. Long-standing concerns that date back, that look at poor oversight of long-term care facilities. It's been reported by the LAO back in 2004, Bureau of State Audits, 07 and 14, the U.S. Office of Inspector General in 2012, the Senate in 2012, again the auditor in 2013, as well as several external assessments. So with regard to licensing and certification, What's the deal? We're clear that regulations have been challenging in coming out of your department in a timely manner. I'm clear that that's part of the problem. Some of the vacancy rate, what's the position, the nurse, let me get the title correct, the health facilities evaluator nurse that came up in my budget subcommittee the last couple of years. Very contentious discussion because of the LA County kind of independent contract. So talk to us about Sacramento Bee just did a series, and like you said, that is something very personal to all of us. It is our most vulnerable population. They are the elderly and the sick and the infirm. So tell me what the department is doing, what's gone wrong, and what shift under your leadership, can we expect to have some different kind of results?
Thank you for that question. Well, for those questions. I certainly came into this appointment with what I call eyes wide open about this issue. Having been a healthcare administrator on the other side of things and having been the one that was surveyed or has had complaints investigated against on the health facility side, and also having worked as a nurse and having been on the delivery side, I knew of a lot of the word on the street, if you speak, and then also, of course, I saw all the reports and the auditor reports as well. And as you know, and the legislature has kindly provided over 237 positions last year, which are being hired into place right now to help address part of that. So part of it was really looking at, are there enough resources to do the work that needs to be done? Are there enough resources to be timely when there are concerns? Are there enough resources to even do the core part of the job? And so that was one aspect of it. And most of those positions, but not all, that were approved are health facility evaluator nurses. Those are being in the process of being hired. And I have to tell you, knowing that those positions are hard to hire for, I've been very, very impressed with some of the initiatives that our leadership team there has taken, that we have taken, to really ensure that we can onboard those folks and really recruit. And we've hired, as of March, 110, have been since July, which is
That's impressive.
is very impressive. Even I got a postcard in the mail one day around Christmas trying to
you
recruit
too
me
can
from
have
my
two
own
jobs,
from my own positions. But I think there were a lot of innovative ways working with our human resource branch and really looking at the 14 district offices and how we can be more innovative about hiring, be responsive when people have an interest, make sure that they can apply online and then maybe choose different places that they would like to work at and interview all at the same time and hear back very quickly. Then the other part that's really important is the onboarding piece, and those positions do take 12 to 14 months to fully train so that they can be fully effective. This is both mainly meeting the federal requirements as well as some of the state work. And really making sure that we have good onboarding and training for those people in place as they go out on surveys until they're full-fledged surveyors. So one piece is was the resources. The other piece really spoke a lot to process, inconsistency. And if you called one district office had an issue that they were dealing with, it didn't necessarily, the results weren't necessarily the same between district offices was one of the concerns. And so there's a lot of opportunity, and there was, and lots of great work around really looking at what are the key processes, what do they look like, where are they working, and where aren't they working, and what do we need to do, and by the way, why do we have different processes? And so a lot of good quality improvement work has been going on through a formal quality improvement project that that whole team has embraced wholeheartedly, that involves people at all levels from throughout the state, working on things like timeliness of investigations. How do you investigate? Do you use dedicated complaint teams? So very formal work plan to implement the improvements is in place, and a really great work plan with timelines and deliverables to make that happen. And it is being publicly posted as to how we're doing and what we feel we have completed and what we have done to do so. And at the end of the day, the feedback that we receive from stakeholder will be the proof in the pudding, right?
Will
As
be.
well as, how many days and does it take us to do things, but it's really about how do people feel about the Department of Public Health and the licensing and certification function. That's going to be one of my key measures.
So this may be an unfair question, but I don't mean for it to be it's not a gotcha kind of thing. But when we heard testimony from the health facility nurse evaluators currently kind of, in the field, coming to support the budget augmentation, they were clearly impassioned professionals who were drowning and asking for help. And so, from the legislature's perspective, we did that, and we are an impatient lot. And so from our perspective, well, we did that this budget year, where's the return kind of on the investment? And so as I hear you in thinking about it strategically, you've got to onboard, train, that's another year. When can we realistically, all of us, expect to begin to see a turnaround in this really historic, challenged division within your department? Because the stories we hear from the ombuds people and the family members and our own life experience in going in some of the long-term care facilities is dangerous. And so when can we expect it? Is this a 4-year, 5-year turnaround project? What do you think?
So some of the things we should be able to see effects immediately, and we are starting to see impact in some areas already. And then this year, we have certain goals where we're setting out to implement dedicated complaint teams throughout the state, which should, then look a certain way as we investigate complaints. Overall, between getting everybody on board, we're going to get another, we just got the other set of the positions that were released for us to hire, getting them all on board, hired, trained, and being fully effective folks that are going out there. And provided that we continue with the great work that's happening right now and real focus on process improvement, quality improvement, I predict that we should be seeing and feeling, public feeling, they feel, a real change and a real impact within the next 3 years.
Okay.
But it's not like it will start in the next 3 years, it's starting now.
I got
so
it.
we just need to, it will take some time.
I'm clear it'll take some time because it's been a long time coming in terms of some of the challenges. And lastly, I would just kind of talk about the vacancy classifications. And I appreciate that the department-wide average vacancy rate is about 5%, so that might not be too out of sync with other state departments. But again, the health facilities, nurse evaluator nurses, some of your CEA positions, as well as, the broader expectation around succession planning within all state departments. So can you both talk a little bit about your planning in that area and what we can look forward to in your department? Because, you don't hear a bunch of young people graduating typically from schools from public health. And while we talk about the critical nature of the work you do in terms of surveillance and prevention, so where are we there as a state department?
And so you just discussed kind of one of the big areas where we have vacancies, and it is in our HEF or nurse class, examiner's classification. You mentioned our CEAs and our AGPAs are the other two main classifications, but succession planning, when we talked about kind of risk areas for our department, that's obviously not just for our department, but across the state succession planning. And, the average age of our employees is 51. The 52% of our employees will are over the age of 50, so technically could retire over the next 5 years. And so that's a challenge that we definitely have to address. So we do have a succession plan in place. We have 4 risk areas, but 2 that we've identified are recruitment and retention. And one of the things that we've been doing recently is we've tried to determine how do we establish a pipeline of new students, new employees into our department who are interested in public health. And as a matter of fact, just yesterday, we sat down with representatives from California State University, Sacramento, and Los Angeles to discuss what an internship program could look like. And we're looking to bring about 8 to 10 students per quarter into our department who are in those public health schools in that school system, and that represents about 15 different school systems and about 400,000 students from those campuses that we could potentially tap into. And so that effort is going to be starting up right away, because then we really have people who are interested in the field of public health, and hopefully that can address some of our recruitment issues right there.
Excellent. Thank you very much. I appreciate
Thank you.
your answers.
Thank you very much, Senator Mitchell. Mr. Cannella.
Thank you, Mr. Pro Tem. Senator Mitchell's questions were very thorough, and the answers were very thorough as well. So I just one additional question for you, Ms. Christ. When Dr. Smith was here, however many weeks ago, I asked the question about the Zika virus, and she thought that California was pretty well suited to deal with it for various reasons. But it seems like it's kind of exploded a little bit in a negative way. So I wanted to get your perspective on where we are, and are we in a position to be able to handle that?
Sure, thank you. It certainly is very much in the news, and it's very scary. I feel we are very prepared to deal with Zika. One of the things so we measure it and publish the cases weekly. While we still have and have had the mosquitoes in about 12 counties that in other countries transmits the virus, we have not had any California Zika transmissions via the mosquito. We have had one sexually transmitted case of Zika so far. So I think overall we've had 35 so far. So the real measure is really making sure and doing everything we can to work with our local vector control partners and to work with the CDC and with all the resources that we have to prevent the local transmission of Zika virus, and that's the measure that is best used to look at control. We're not going to prevent the mosquito from, we're not going to be able to eradicate the mosquito, so we really have to make sure we mitigate the mosquito, provide the vector control, and help prevent the actual transmission here within California.
Do you see a scenario where it could explode like it is in South America? What's your thoughts on that?
I'm certainly not the epidemiologist specialist, however,
Good. Serious is okay.
having spoken to our state epidemiologist, Dr. Gil Chavez, most recently, we're very fortunate that we have a couple of things here that they don't have in a lot of the South American countries, which is much better overall systems on vector control and prevention, and different conditions as well. So we don't feel that we would have such an incident here, and we're really looking to make sure that we prevent local transmission.
How much in dollars have we set aside to deal with it in California? Do you know what our budget is? Do we have a budget for that?
I do not know the current actual dollars. I would have to get back to you on that. I do know that the federal government has set aside at the CDC level money to help with Zika as well. And then also that we will be in California getting some money to help
From
Zika
the
as well.
feds?
Yes.
Correct.
Okay, great. Thank you. That's all my questions.
Thank you very much, Mr. Cannella. Ms. Leyva.
Thank you, Mr. Pro Tem. Good afternoon. Appreciate both of you being here and appreciated the time we spent together. You both have big jobs, a lot of responsibility. I want to talk a little bit about water, most specifically lead in water. There's been a lot of attention in the news about water and lead in the water. What kind of program do you run? Do you think it's effective, not effective? Because we know that there are no safe levels of lead, and everybody should be entitled to safe drinking water.
Thank you for that question, Senator. Well, as we all know, the overall control of the water systems and overview of the water systems is handled by the Water Resource Control Board. However, at the California Department of Public Health, we do a couple of things. One of them is as part of our childhood lead testing and prevention, when children that are test with high lead levels, we do look at all sources in their surroundings. That includes the water. So we test that as well to see what the source of contamination, what the source of that elevated lead level or sometimes even lead poisoning in a child is. So that is one of the areas that we, if there is a high lead level detected, we always test the water as well as part of the surrounding.
So is that part of the 700,000 blood tests that are done annually?
That is correct. 700,000 children are tested every year.
And if lead is identified in the home, how do you work with the family to eliminate the source of the lead?
So we do a couple of things. Depending on the source of the lead, we may connect them or connect with the appropriate resources. It depends on, oftentimes it's the paint that is the source of the lead. Sometimes it is food sources, so they can do direct teaching and education about what the food is. Certain types of foods that people eat may contain lead, and I mean more like some of the ethnic foods that are imported, certain crickets and snacks like that, or certain spices sometimes have that.
Okay.
Very tasty.
Okay, excellent. I might watch my lead intake then. Okay.
Sometimes it could also be the work environment of the parents, where the parents may be bringing something home on their clothing. So it's really looking at the environmental scan and working with the families directly to reduce and mitigate the source of the lead. And then going back and depending on the lead level, continuing the testing and also providing case management to those folks. So really keeping a close eye on them.
So if you found a home to have lead either in the paint or in the water, would you then contract with another agency to rid the home of that lead? Does that fall under your purview?
Potentially, or work with the local health department as well. And sometimes it's a matter of trying to get them moved out of the environment. Yeah.
Okay. Thank you very much.
Thank you very much, Ms. Lay. But let me ask you a question, Ms. Kreis, and it may be, it's a technical question, which I don't have the technical expertise. You had mentioned lead in perhaps paint chips from on houses that at the time the paint product contained a tremendous amount of lead. Do we have the scientific technical ability to differentiate lead paint chips from a house? In this case, for example, in Southern California, Los Angeles, the whole issue with exide and emissions of lead that have contaminated this community. Is the forensic scientific technical expertise or some sort of instrument of some sort can actually define and measure this lead that's contaminating, that's in the bloodstream of this child or on the ground is from this source as opposed to that source? And if you don't have the technical, don't worry about it. I'm throwing it out of curiosity.
I cannot answer the technical question on the direct correlation between the lead source, but I can tell you that in having the amazing opportunity to tour our Richmond laboratories, I did have the opportunity to have the lead demonstration through our 3D electronic microscope, and it's just amazing that you can actually directly identify to the most minute particle the actual lead in the actual source. And so from that perspective, I feel comfortable with the technology, but as far as the direct correlation between source and elevated lead level in the blood, I'm sorry, I can't answer that question.
Okay,
I'd
all
have
right,
to
so
get
don't
back to
know.
you.
Okay, that's okay, that's fine. I detected a slight accent.
Yes.
Where are you from originally?
I'm from Germany.
Oh, from Germany.
Yes.
Okay, I detected a slight accent there. Okay, welcome. Well, listen, with that, if there's no further questions or commentaries from the members, those individuals in the audience who are in support of either Ms. Christ, I should say, Mr. Nunez, or both, please coming up. I would ask you to be brief in your commentary with regards to their
Gary Passmore with the Congress of California Seniors. Good afternoon, Mr. Chair and members. I will be very short. I know I'm one of the people you worry about. I am really honored to be here.
can I say something? I just very much appreciate that you self-recognize, because there's a lot of folks who are completely oblivious.
Just
and will
because I
continue,
keep talking doesn't mean I know you don't want me to. I have enormous respect for Claudia Christ. I have worked with her in trying to retool the Coordinated Care Initiative during her time in the Department of Healthcare Services. I think that if there is a solution, even if it's way out of the box, she is a person who will go there and bring it in and try to fix what's in front of her. I sighed a big sigh of relief when I heard she was going to this position in health, because I've been worrying about the health agency's oversight of long-term care facilities for over a dozen years. Thanks.
Thank you very much. Thank you very much. The next witness in support.
Mr. Chair and members, Betsy Armstrong on behalf of the County Health Executives Association, here pleased to support Ms. Christ and Mr. Nunez in their nomination. Our folks are the local health department directors and have just all have been very appreciative of your responsiveness and collaboration working with our folks. So I urge your support. Thank you.
Thank you very much. Next witness in support.
Kat DeBerg with the Health Officers Association of California, in support of both Mr. Nunez and Ms. Christ, and we echo everything that our colleagues at GIEC just said. Thank you.
Thank you. Any other witnesses in support? Seeing none, those in opposition? Seeing no opposition? Okay. Colleagues, I think we've heard a good amount of testimony and a good intake. Thank you, Ms. Mitchell, for your questions. Can we entertain a motion? We have a motion made by Ms. Mitchell. Madam Secretary, please call the roll.
Senators Cannella? Aye. Cannella, aye. Leyva? Aye. Leyva, aye. Mitchell? Aye. Mitchell, aye. Runner? DeLeon?
Aye.
DeLeon, aye.
Ms. Christ, as well as Mr. Nunez, congratulations. You pass on a 4-2-0 vote. Congratulations. Okay, colleagues, we're going to move on the agenda. We're still on file item number 2. We're going to go to C. That is Mr. Edgar